Good evening, ladies and gentlemen, Mr. Chairman. Just to reiterate, here are some of the most crucial points of the debate. Locked up means against their will, whether it be in prison or institutions. We're against both. We're not saying that they shouldn't be locked up in institutions, but we're okay with them locked up in prison if they commit a criminal act. We're not saying that at all, and I'll just get back to that in a second. The next thing is, are they dangerous or are they not? That's probably the most important point in this debate. Well, again and again, we're saying this is a social stigma. These people are not dangerous. Only 1 in 11,000 people are dangerous. Why would you lock up 11,000 people so one person doesn't commit a crime? That doesn't make any sense. And if that person is already severely ill, answering the question of the chairman, then he's already been seen by a psychiatrist. That's how you know he's mentally ill. That's the responsibility of the psychiatrist. There's medical guidelines guiding actions in this situation. The next thing is that we're against them being locked up in jail, and they are already being locked up in jail. And just for things like you said, when they cause disturbance in the street, they're taken to court and they're detained based on their mental status. Why should we leave the decision and the fate of these people in the criminal justice system? These people are not criminals. They're just people with illnesses. These people are not going to kill anyone. Their biggest crime is to cause a disturbance in the street. We shouldn't lock up these people for these things. Now the next thing is all about the treatment.
You can leave if you want.
Thank you. Okay, these treatments never ever require them being in institutions. There's a treatment called dialectical therapy. Now, dialectical therapy aims to solve schizophrenia and depression because by convincing these people that their thoughts are normal, you're trying to reverse their psychology to help them fit into society. How are you going to do that if they're in an institution and all they see are psychiatrists and other mentally ill people? Once you release them, even if they got better, they're just going to go back to their original state. How about people with post-traumatic stress disorder? These people are mentally ill because they've seen bad situations. Now you're saying, okay, let's lock them up and have the society stigmatize them, and they're magically going to get better. You're just adding trauma to the trauma that already caused them post-traumatic stress disorder. Another therapy is family-based therapy, and that's helpful for people with depression, anorexia nervosa, bulimia, all these mental illnesses that are not actually that bad. So they need their families with them. All they need to do is have their families trained by a medical practitioner. That's why we're here for. We're not here to tell people, okay, let's lock you up in an institution where all you're going to see all day are doctors in white coats and food that we give to the mentally ill people. This does not help them in any way. Mental illness does not ruin a person. Let's consider some people, famous people, that have had mental illnesses and yet made it far in our society. John Nash, who won the Nobel Prize, had schizophrenia. So should we have locked up John Nash? He had schizophrenia and he won a Nobel Prize. That's just the ultimate proof that these people are not ruined as humans just because they're mentally ill. They do not deserve to be locked up in institutions. How about Catherine Zeta-Jones, or Mel Gibson, or even an author like Edgar Allan Poe and many others? All these people have produced have done wonderful things for the society, even though they were mentally ill. When you lock these people up, you're furthering the stigma. You're just pushing them back into their mental illness, and once they come out, they're going to be worse than they are. No, thank you. Well, I'm not sure exactly, but what I know is that he had schizophrenia and he won the Nobel Prize. And that's all I care about, is that just because these mentally ill people have illnesses does not mean they're ruined as human beings.
Thank you very much. Time's up.